Tell us about any type of first aid kits that are sold in drugstores.
Okay. I brought some of those. So I'll pull some of those out, right?
Okay. The reason why I asked this, as I walked through my drugstores in Arizona last weekend, where I was at, to get my Shingrix vaccination, I knew that this talk was coming up, and I just perused what's for sale for snake bites. There's an amazing amount of for-profit baloney out there. And it is baloney. It's snake oil, literally snake oil salesmen, and it's probably $1 billion industry gearing on your fears. The danger of these are that they delay your presentation to an emergency room. And so let's show some of these.
Yeah, okay, so there've been, I mean, there's been a whole lot of different sort of first aid techniques, but one of them is this whole cutting and sucking, these kits, like these kind of kits, and they don't help. In fact, they can make the injury worse. And so we've kind of, even this summer, we're kind of getting on a campaign to say, look, don't like put a suction cup on a snake bite. It doesn't help. Don't be reassured by that. And it can cause further injury. And I mean, I've studied this myself personally, and so I just want to say that this kind of first aid is not good. It's not helpful for snake bites.
It's actually destructive because it's going to delay your presentation to qualified doctors in the NASH ER.
Well, and on top of that, these things exert so much suction that they can actually add injury to the snake bite, right. And so. We don't want to do that. I think that sometimes people get a little overzealous when there's a snake bite, and like if they feel like a little ice helps the discomfort a little bit. Well, for a while they were advocating cryotherapy. You immerse the extremity in ice, and that adds frostbite to the snake bite. So you don't want to do anything that's going to make it worse. You don't want to cut into the snake bite.
The thinking would be that we can vasoconstrict or squeeze down the blood vessels and stop the spread of the venom. Purely bunk. The right answer is strictly to get to the anti-venom, and the right answer is to get to the ER where they have the anti-venom.
That's right. That's right.
And Dr. Isley informed us today via Gene that our ER is up to speed and capable of dealing with these issues.
Good.
So 911, let the ambulance transport your family member, because they can start resuscitation right away, and you can't do that in your car.